Disasters. They can happen anytime, anywhere. But when it happens, you should be prepared. This video will prepare you for these type of situations. If you haven't watched the first part, it's in the description. Watch it. After you watch the first part, watch this one. Okay. If you're watching this while you're in the bathroom, cooking, picking your nose, doing anything, leave that and focus because this video needs your attention. Let's say something terrible happened, like a disaster, like a giant building just suddenly collapsed. This is how you should react. In the first part, we talked about scene safety, make sure that the scene is safe. Second part, let someone dial 911 and then enter the scene. When you enter, try to look for a chair, a table, something that's kind of elevated from the ground level. Stand at it, and then you want to look around and organize. Remember the 4 victims that we talked about, the green, yellow, and red and black? You want to organize them and put each group on a side. Okay, you made a plan. Now you should scream as loud as you can with authority. If you can walk, go to the right, next to the pink chair over there. You over there, you can walk, right? To the right. To the right, everyone. If you can walk, go to the right. Now you're done with all the green victims, but you still have red, yellow, and black. Everything that I'm going to talk about in this video is going to be in a chart. That's called START Triage. START stands for Simple Triage and Rapid Treatment. Simple Triage and Rapid Treatment. When you look at the chart, there's going to be a lot of information. Don't be scared. I got you. There's no room for treatment right now. We want to organize the victims. But we only do 2 treatments for now. If someone is not breathing, we open his airway, just tilt the head backwards to check if he's breathing or not. That's the first treatment. The second treatment is managing a severe bleed. I'm not talking about someone's having some blood over here or a little bit of blood on his head. No, I'm talking about a severe bleeding. Like there's a lot of blood pouring out from the person. That's when you try to stop his bleeding. Now, how would you do that? I made a video about it. It's in the description. These are the only 2 treatments that you do for now until you sort out all the patients. Okay? Okay. Now, before doing anything, you need an emergency chocolate. This chocolate is only for emergencies. Now you want to go to each person. You're not going to spend more than 30 seconds on each person. You got to be quick. You want to determine if this person is red, yellow, or black. You want to organize all the victims because you want to save as many people as you can. Now you want to go to each victim that can't walk, that's on the ground and can't walk. You want to know now if this person is red, yellow, or black. How would you know that? You want to ask yourself, you want to assess the patient and ask yourself 4 questions. Now let's look at the chart. The chart is going to be easier. Now you know this already. If the person can walk, he's a green patient. That's it. He goes to the green group. Now we start with the first question. Is the person breathing or not? If he's not breathing, that's when you try to open up his airway. Try to tilt his head. If you open up his airway and he's still not breathing, then he's a black patient. Then he's dead. You're not going to do CPR. You're not going to start blowing into his mouth. You're not going to do anything. He's dead. If he starts breathing right after you open his airway, then he's a red victim. Yes, he's breathing right now, but there's something wrong with his breathing. He needs to get to the hospital as fast as possible. He's in the red group. At this point, you need a pen, any pen at all, and just write red. Right on his forehead, red. Now, if the person is breathing, he passed the first question. The second question, you're gonna ask yourself, how well is he breathing? What's the breathing rate? I don't know if you know how to count the breathing rate, but you just look at the chest and try to calculate how many times the person breathes in 1 minute. And that's the breathing rate. Now, if you forget how to calculate the breathing rate, or you're distracted by all the noise, just try to look at his breathing. Is there something wrong with his breathing? Is he breathing like Is there something wrong with his breathing? Or the breathing is more than 30, he's a red patient. If the breathing is less than 30, the breathing looks fine. That's when you ask yourself the third question. Now the third question is, do you have a proper cap refill or a capillary refill? Now if you don't know what that means, don't panic. It's easy, it's extremely easy. Now by this test, we just want to know if the blood flow to your tissue is normal or not. So I don't know if you can see this, but yeah. Okay, so look at the color of my finger. Now when I press on it, it should turn white. When I remove the pressure, it gets to the regular color very quickly. This should normally happen in less than 2 seconds. See? One. So by this test, I know that I have regular perfusion to my fingertips. So I have regular perfusion to my tissue. If it takes more than 2 seconds, if I press on my fingertip on my nail and it stays white for more than 2 seconds, that means that you have a perfusion problem. There's something wrong with the perfusion. Or you're dehydrated. There's something wrong with you. You're a red patient. Now if it's 2 seconds or less, which is normal, to this stage, your breathing is fine. You have a decent capillary refill, which is 2 seconds or less. The fourth question is, can this person obey my command? How is the person's mental status? Is he awake? Can he understand me? I'll just ask the person, can you just raise both of your hands for me, for example? Can you look here? Can you press on both of my arms, please? Can you do anything? I just want to know if he understands you or not. If he doesn't obey commands, and he's a red victim. If he does, and he passed all the 4 tests, the 4 questions, then he's a yellow patient. I don't have a yellow pen, so he's gonna be a yellow patient. You take a pen and you write yellow. If the person is breathing and there's something wrong with any of the 4 questions, red patient. If the person is not breathing, even after you open his airway, black and dead. How pretty is this? You're gonna see the same chart in the description. If you understand this chart, if you know what it means, if you memorize it, then if a disaster happens to you, you're gonna manage all the patients, all the victims correctly. Now after walking around and spending around 30 seconds on each patient, and after marking the color of their group on their forehead, then you're gonna organize and take all the red patients on one side, and then the yellow patients, you put them on in the middle, for example, they're all on one side, the green, they're already on the right side. Now you're fully organized. Now remember, in these situations, you gotta be strong, you gotta be confident. There's gonna be a lot of people screaming and crying around you. You can do this. If you think this video is helpful, please share it. People really need to know about this chart, and I need some subscribers. That's all I have for now. See you every second Wednesday. If you have any questions, comment down below. I'm gonna respond to all of your questions. Goodbye.